Hi, my name is Noah Hughes with the Durham Fire Department, and today I'm going to be teaching about placement of a sling and swath on a patient who has a dislocated shoulder. Now, a sling and swath can be applied for multiple different reasons in EMS, one of them being a dislocated shoulder, others a clavicular joint reduction, a broken clavicle, or a humerus fracture after splinting, or even utilizing a sling without a swath for patients who have some kind of elbow or forearm injury. Obviously not utilizing the swath there just because of the pressure it would apply to the arm. So those are indications. Those are going to be why we're going to utilize the sling and swath. And as far as contraindications go, there really isn't a contraindication as to why we wouldn't want to apply a sling and swath to a patient who needs one. There are some issues that we could run into that you might want to have in the back of your mind and be considering while you're placing your sling and swath, on your patient. But overall, it's a pretty safe procedure as long as you're following the instructions and doing the procedure properly. So that being said, complications that can arise, and I'll get further into this as we talk about the steps for placing the sling. If the hand is not completely covered by the sling and swath, it can hang at an angle that's too harsh and compress the ulnar nerve, which can lead to some nerve damage down the road. But that is a problem that can be easily captured by just having the sling extend all the way from the elbow past the hand. And I've attached a skills video at the end of this lecture portion where I have some firefighters that I work with who are going to be putting on a sling and swath, one putting it on the other one, and I'll kind of narrate through I'll narrate through the steps that they're doing so you can see it done in live time. And at the very end, you'll notice that as the firefighter who's placing the sling and swath on the other firefighter, at the very end, his hand is kind of at that borderline area where it could be hanging too much down, and you'll see that that's where the ulnar compression can occur when you're dressing the sling and swath at the very end, if it's not properly covering the hand. So the steps, as far as walking through the steps for what we're going to do when placing a sling and swath. First, identify the need, right? So we talked about the indications and why we would want to put a sling and swath on a patient. But now it's more of, we've identified the need for it, we've got our equipment, and we're going to place the sling on a patient now. So the first step would be to position the patient properly. And I know in the world of EMS, ideally, you can have every patient standing in front of you. You've got full access to their whole body. You can go around them, which would be the ideal situation here as well, because you want to have access to the trunk of the patient where you could be able to walk around them when placing the swath portion around their torso. So position them if you can. Standing would be ideal. And then have that patient hold onto their arm in a position of comfort. And they're going to know what that position of comfort is because they're either going to be hurting. And for this example, we'll be talking about the shoulder, specifically a shoulder dislocation. They're going to want to relieve that gravitational force that is dropping their shoulder further down and creating pain at that injury site. So have the patient hold their arm at a 90-degree angle if possible, in a position of comfort for them. And that way you can assess for PMS, which is pulses in the extremity, getting a radial pulse, check their motor function, have them wiggle and move their hand if they can, if it doesn't disrupt their injury. And then S for sensation. So being able to touch their fingers, do you know which finger I'm touching? And then you're covering all of your bases to make sure they have that, both the PMS all intact. So the patient's holding their arm, you've checked for PMS, it's being held at that 90-degree angle, that's taking the gravitational force off of the shoulder being dropped down. You'll get your equipment out. So for us, we carry triangular bandages, which is what we'll be utilizing for this skill set. So get out your first triangular bandage, and the way I think about this in my mind, so we're not messing around, turning a whole bunch of different angles as to which corner of the bandage goes where, I always think of put the 90-degree angle of your triangle bandage to the 90-degree elbow of their injured arm. And in the skills video, you'll see what I mean, and you'll see how that's put into practice. But the 90-degree angle of the triangle bandages matches the 90-degree angle of the injured arm. And then you'll take those two 45-degree angle straps up and around the neck, tying them, securing them, and then that patient can remove their hand from holding that gravitational force off of the arm, and the sling will catch that weight, which should help provide them with a little bit of relief from the pain that's being caused from having to support that arm with an injured shoulder that's no longer in place. So we have the sling attached, we have it covering the whole hand, we've assessed for PMS, it's tied and the weight is supported by the arm. So now we're going to move into positioning the swath. And because this patient we're talking about has a dislocated shoulder, we will be utilizing a swath. Like we talked about earlier, there are situations where if you have an injury to the forearm or elbow where you don't want to compress that injury against the body. But with the injured shoulder, we do want to have that compression of the swath so the patient doesn't have the access to move their arm out and away from their body. If they were to lean forward, it's not going to swing out in front of them. And if for whatever reason they would want to lift their shoulder up or lift their arm up above their shoulder width, which they're not going to want to if it's injured, but we have that restriction in place right there. So when placing the swath, we're going to take our second triangle bandage because, like I said, we carry 2 triangle bandages. This is our protocol with the fire department. The second triangle bandage will come out and be rolled into a section that's about 5 or 6 inches, almost like a little band about that thick. And we're going to position that band all the way across the patient's torso and above that injured arm's radius and ulna, their lower forearm. So the swath will position across the top of the injured arm. I've seen, there's lots of information out there on the internet that shows people with them bandaged up higher and they've captured the hand inside the swath. There could be other logic behind that, but as far as the protocols that we operate with, we always keep that arm positioned in the 90-degree angle and wrap our swath directly across the chest. When you're placing the swath across the chest to prevent that motion away from the body, we have the patient take a big deep breath while we're tying that swath in place behind them, and that's just to make sure that we're not really ratcheting down that strap and restricting the breathing of the patient. So we'll have them take a big deep breath, tie our swath behind their back, and then as that patient exhales and releases that breath, we know that they still have the ability to expand and contract the chest and take regular breaths, and it's not going to be inhibiting their ability to breathe. For individuals who don't use a secondary triangle bandage, which is very common that a second triangle bandage won't be used for the swath, you could use a 6-inch ace bandage roll. There's a little 4-inch or 4 or 6-inch gauze rolls that can also be wrapped around. It's anything that's going to prevent that arm from swinging out away from you. So in wilderness medicine, it could be a t-shirt, whatever it may be, but it's just in place there to keep the arm moving away from the body. So sling's in place, swath is in place. Once those 2 things have been addressed, then the last step would be to go back and dress your bandages so they're not sitting over an injured site. If it is to a splinted humerus that's going to be in the sling, you don't want to have it compressing against the body as well, so you can position it lower towards the elbow. But going back and dressing that so you don't have your 6-inch secondary triangle bandage for your swath hasn't been compressed down because you've tightened it so much that now it's only 2 inches or so, and it just is like a rope across their chest. So we go back, we dress the bandage, we'll open it up and make sure we've got good coverage across the body to make sure that we're dispersing the tension that swath is providing to the body. And we want to go back and we'll ensure that the sling is not stopping below the wrist, and so that wrist is just hanging and compressing that ulnar nerve. And you'll see in the skills video attached at the end, and I didn't catch it while we were doing our skills video, but he does place he doesn't go back and dress that portion of the sling once he's placed the swath, and it's sitting right at that borderline area where I would like to see it up a little bit more and see that sling capturing more of the hand to prevent that wrist from flopping down. And then the last thing we're going to do is we're going to check for PMS one more time to make sure that our sling isn't too tight, our swath isn't too tight. So again, pulses, motor function, and sensation in the fingers. We're grabbing that radial pulse, and we're going to prepare for transport. And transporting this patient's best case scenario, they can sit up, which will provide them the most relief, because if they can sit up, then again, you're combating those gravitational forces that want that arm to sling down. If you were to lean back, you don't want to put any stress on the back of the shoulder. Most of these patients would be most comfortable sitting straight up and just having that sling and swath capture the weight of their arm. But the skills video is going to be attached next. You can run through all of it. See what I mentioned here at the end, that hand. I would like to see a little bit more capture of that sling of the hand. But if there's any questions, please reach out. Any questions, comments, add them below in the video notes. I'm happy to address them, and thank you for your time. I appreciate it. All right, this is going to be the skills presentation portion of the application of the sling and swath on a patient with a dislocated or separated shoulder. So Abdullah is going to be placing Nate here in the sling and swath. We're going to walk through every step and some of the things he's going to be looking for as he places this patient in a sling and swath. So the first step, if available, we'll have the patient stand just for easier positioning, and that way Abdullah will be able to wrap circumferentially around the patient. Obviously this won't be applicable in every situation, but if it can be, it just makes it easier for Abdullah to do his job. So with the right shoulder being injured, the first step is that Abdullah's going to have Nate hold that arm in a position of comfort, and we're going to try and keep it at 90 degrees from his shoulder to the elbow out to the hand. So you see Nate here is going to be holding that position while Abdullah gets the first triangular bandage out and ready to be placed on the patient. So as he unfolds the whole triangle bandage, there's going to be 2 acute angles and 1 right angle on the bandage. He's going to take the right angle and position it towards the injured and affected arm. Once he has the bandage all the way opened up, that corner that's facing the injured arm, he'll tie a knot that's going to create a cradle for the elbow to sit once the sling has been placed. Once the elbow is in the position that a position of comfort for the patient and the knot has been placed at the corner, Abdullah is going to move the other end of the sling up over and behind the head, still while Nate is holding his position, his arm in that position of comfort. And he's holding the weight here because the sling hasn't been tied and taken that pressure off of the shoulder. Now once the sling is in place, he's making sure that arm is still held in a 90-degree angle. He's going to check for pulse, motor, and sensory feeling in the hand extremity. So we just saw him do that. He checked for a pulse. He's going to ask him, can you move your fingers? And are you able to squeeze my hand? Perfect. So we know that we have PMS is intact inside that arm. Next, Abdullah is going to get out his second triangle bandage, and this is going to be the swath placement. Now out of the package, these triangle bandages, they're usually folded 1 or 2 times. These ones have been out of the package a couple of times, so he's going to have to refold it back into a strip about 6 inches across. And we'll see him do that now. Yeah. Now, the swath is going to be placed to prevent any motion away from the body, or if the patient is to lean over, it's not swinging away and creating that motion forward. So this is going to be holding it tight against his body. So Abdullah just asked Nate to take a deep breath. So as he's taking that deep breath in, Abdullah's going to tie the back of the swath to make sure that he's not restricting any breathing with the tightness of his swath. Now once it's tied, Abdullah's going to come back around and just dress out that second bandage, make sure that it's covering the elbow and that it's tight to his chest, and that during any moving that the swath hasn't broken loose. And Abdullah can have his patient lean forward and see if they're having any of that swing away from his body. And you can see he's got adequate tightness on that swath because it's not drifting away from the body. And one last time, he's going to check for PMS, which is intact. So we have the sling and swath is placed, and we can come circle around one more time. We'll just take a look at the knotting in the back and in the front.